Hello.
89-year-old Dr. Elbert Cole doesn't believe in retirement. In fact, while his own ministry career ended at the age of 70, he says that was really just the beginning.
The word retirement is outdated, and I'm doing everything I can to find a new word for it.
As Cole searches for that word, he's not only blazing a new trail for America's seniors, he's actually changing the very landscape from where misperceptions about this population stem.
You remember when we referred to nursing homes as rest homes? There's not a lot of resting going on in them now.
Thanks in large part to Cole's leadership and his lifelong commitment to others. Today, we find Cole in Kansas City, Missouri, in an office of the Shepherd Centers, an organization he founded here some 35 years ago, and landing in the national spotlight soon after its inception.
Shepherd Center. Their program is outstanding among many recently begun around the country, and it has become a model for others to follow.
Today, there are more than 75 of these centers in 21 states across the U.S., with approximately 100,000 participants. All the centers are designed to enhance the health and well-being of older adults, a concept Cole took from idea to reality.
His focus on aging is ahead of his time, and he has been the difference in many ways in changing the image of aging in America.
Cole's journey begins in 1918, born in the small town of Advance, Missouri. Always a social boy, enjoying scouting, lifeguarding, and in high school, a job as a huckster, going door to door selling vegetables. In college, majoring in philosophy, he becomes student body president and meets his future wife, Virginia.
She was a freshman, I was a junior, and I spotted her out in the crowd and I said, that's the one for me. There was a palpitation that went on in my heart, and you know what? I never lost that in the whole 60 years of our marriage.
He soon discovers a calling to the ministry, and after graduating, enters divinity school at the University of Chicago, where he earns his theology degree. America is at war. Cole enters the Navy and becomes a chaplain. From 1942 to 1944, Cole is on the Pacific Ocean, aboard the Navy ship the Saratoga. He holds religious services and does personal ministry. When the war ends in 1945, Cole and Virginia start a family, and for the next 40 years, Cole ministers in churches around the Midwest, finding a calling in mediating from the pulpit, and always doing it with a great deal of kindness and a gentle sense of humor. But it's when he moves to Kansas City in 1965, where he will minister for the next 23 years at Central United Methodist, that he discovers his next calling, those who are retired. He hears their resentments, many feeling misunderstood, not worthwhile, due to the negative concept associated with their age.
He knew as a pastor that he had to do something important for older adults, that churches throughout America were not responding to the needs of older adults.
Aging was really still the struggle to find meaning in one's life. And it's easier to find meaning in one's life when one's in the middle of a profession, of a job, of raising children. You have kind of all these meanings imposed on you. Well, we, as we grow older, still need to find meaning in our life.
In 1972, an interfaith, interdenominational movement is born in Kansas City. Led by Cole, he's captured here on film in 1976.
One of the things that we have to keep working on over and over again is to identify the people in our community who get lost, who just quietly out there somewhere in our territory just are so silent that society doesn't hear their cry. And we want to hear that cry.
We first began to deal with problems of aging as a policy issue, that we had to be sure there was adequate Social Security, that there was health care, Medicare in the 60s. Some programs needed to be put in place that would materially affect the well-being of older people. He was saying there were more than geriatricians and gerontologists and psychologists and sociologists that needed to deal with this aging phenomenon. There were ministers and theologians that needed to bring to the discussion about aging some other elements that were critically important to one's sense of self as one grew older.
I was totally surprised at the great turnout and how much it triggered in the minds of people. This is what we've been looking for.
He knew that you didn't necessarily have to build bureaucracy to get something done. You needed to just empower people in the community to do what needed to be done for their neighbors.
Elbert Cole understood that in order to serve the aging population, that the older people themselves had to be at the center of that activity, not receivers of health services, but involved. That was cutting edge. We moved into an era of something called lifelong learning. We began to recognize that there was far more to aging than to become recipients of services or burdens to our families or our communities. And Elbert was at the forefront of that.
As the Shepherd Centers begin taking hold in America in the late 70s, Cole begins work on Kingswood, a 500-person residential facility for seniors in Kansas City. It's then that Cole receives some devastating news. Virginia is diagnosed as presumed to have Alzheimer's. He spends the next 17 years caring for her in a way that has inspired a new model for caregiving.
We threw all of the current books of that time on caregiving for Alzheimer's out the window and said, we're not looking for a cure, we're looking for how do you care.
The dignity that came with the way he cared for his wife was palpable. I mean, you could feel it, and others could look at this caring relationship as indeed a model of how it could be best.
It's amazing how life breaks down into so many things where you can reinforce the dignity of human life by reassuring them that they haven't lost everything. There's so much they can still do for themselves.
Since then, Cole empowers each Shepherd Center to study, design, promote, and provide personal caregiving and health referral programs that help people stay well or to cope with chronic disabling conditions.
How'd the service go? Tell me about it.
It was fine.
Was it a good service?
Yes, it was very nice.
Today, Cole is in his 36th year of interfaith leadership, both in theory and practice, on the interrelationships of personal health, spirituality, and aging. He actively participates in community, sitting on a broad spectrum of nearly a dozen boards and foundations. He's routinely quoted in national publications, from the Associated Press to the New York Times. And a discharge letter written by Cole in 1945 to mothers and wives notifying them that their loved ones were coming home from war is published in the follow-up book to The Greatest Generation.
I sent out thousands of those letters, and some mother sent one in to Tom Brokaw, and he's got it printed with my signature.
Cole is currently writing 2 books and has now taken on world hunger as his new mission, noting that each day 852 million people live on less than $1 a day.
So how do I go to sleep at night thinking about that many people? And some people might say, well, turn over and go to sleep. But I don't think that's what we ought to do.
Still, Cole's outlook is bright. Just last year, at the age of 88, after being single for 13 years, he remarried. He and Ruth Ellen had been friends for more than 4 decades.
The reason people follow the lead of Elbert Cole is because of the promise and the opportunity and the optimism that he carries with him for the future of aging in America.
I think we just need to get out of thinking of the future as somehow a decade out. It's tomorrow. And for his tomorrow, you can be sure it'll be involved in caring, in serving, in advocating, in protecting a neighbor, in asking what if among people who haven't got the perspective that he has.
I believe so strongly, as I've seen people work together, that they can create miracles. Not working alone, but working together. And the strong sense of individualism in America where, tough, we did it, we conquered the world ourselves. That's really not the healing force of the world. The healing force of the world are people working together for some common good.
Elbert Cole, a man focused on doing a great deal of good in this world. A doctor, reverend, academic, healer, activist, and leader. A man ahead of his time.